The World Health Organization estimates that there are about 285 million people around the world who live with some form of visual impairment or even blindness. But the worrying statistic is that 1 out of 3 such blind people or people living with visual impairment are actually from India. 1 out of every 3 patients around the world who are blind are from India. So what is the reason behind this worrying statistic? Clearly, there is a lack of awareness among Indian people about early eye checkups and health-related problems regarding the eye, and there is a huge pool of Indian blindness people who are actually preventable blindness sufferers. 80% of people who are blind in India are actually blind because of a disease which is quite preventable or reversible if early checkup and diagnosis is initiated. There are many reasons, there are many diseases among these blindness pool that contributes to the blindness, like cataract, refractive error, glaucoma, age-related macular degeneration, diabetic retinopathy, and some other retinal degenerative conditions. Glaucoma is one such leading cause of blindness in India and worldwide. Now, what is glaucoma? Glaucoma is often called the silent killer of vision. That means often in the early stages, there is no symptoms that can warn you about presence of glaucoma in your eye. It is a disease of the optic nerves. Quite often, there is a buildup of pressure inside your eyeball that degenerates and deteriorates the nerve fibers that supply your eye, which we call the optic nerve. And the worrying fact is that the optic nerve damage, once it occurs, is quite irreversible. Once the nerve fibers are lost, we cannot regenerate them, we cannot cure them. So glaucoma cannot be cured. So what we can do is to prevent the progression of the disease by regular eye screenings, regular eye checkups, regular measurements of the intraocular pressure, that is the pressure inside your eyeball, and examination of the optic nerves. Glaucoma is a very serious condition at a very late stage. What makes you at risk for developing glaucoma? A family history of glaucoma, a higher systemic blood pressure or systolic blood pressure, and diabetic retinopathy, presence of diabetes and other comorbid conditions greatly increase your chances of being affected by glaucoma at a later age. So what we can do to prevent blindness from glaucoma is regular eye screening protocols, regular eye screening camps, checkups, regular eye pressure checkups, checkups of your refractive error status or the status of your spectacles, and your screening of your family members for presence of glaucoma. Together, you and I can prevent such a deadly disease from stealing our vision at an older age. So, get your eyes checked up as early as possible nearest your nearest eye surgeon or ophthalmologist, and get screened for glaucoma, both you and your family members. Thus, together we can prevent such a deadly disease from stealing our vision. Stay healthy, stay safe.